Hi, my name is Walid Tawfiq. I am orthopedic surgeon in Newville District Hospital. Welcome to a new episode of FRCS Problem Solving Practice. How to get the maximum benefit from this video? At least two candidates should be practicing to give a feedback to each other. See the image or listen to the scenario. Pause the video after each question. Answer the question. Try to start broad. Don't dedicate yourself to a diagnosis. Use the algorithm used in the previous videos. The next question will provide you with more information to direct you to the diagnosis and treatment for this specific case. The feedback should be written to simulate the exam feedback as possible. Let's go. Case 1. 82 years old man slept in the swimming pool. Past medical history, THR, on the left-hand side 8 years ago. Describe what you see. What are the important points in history and the examination you need to know? What are further investigation you will order? What is your initial and definitive treatment? If you have no access to the previous operative notes, how is that would change your management plan? That's the treatment received. Comment on this X-ray. Case 2. This is the same previous patient in scenario case 1. He attended to the emergency department with painful left hip 5 weeks after his revision surgery. Describe what you see. What are the important points in history and the examination you need to know? What are further investigations you will need? What is the initial management? Suppose this patient had a reduction in ED, managed conservatively, and the dislocation recurred 3 times. He is keen to go ahead for surgery. What are the basic principles for managing this condition? As a guide, use the algorithm for unstable hip need revision. That is the treatment received. Case 3. This lady attended to emergency department, complaining of right hip pain. She had a right hip replacement in 2001. She had a right femoral fracture with periprosthetic fracture treated with open reduction and terminal fixation 2017. She had a bilateral knee replacement, background of hypertension on single medication. She had a breast cancer with left mastectomy 2009. Describe what you see. What are the important points in history you need to know? How to examine this patient? If this patient had a hip pain prior to the injury, what are the differential diagnoses? What are the further investigation you will need to know? If she is fit enough to go ahead for surgery, infection had been excluded, what is the treatment principles? That is the treatment received. Case 4. This is 59 years old woman, had a left total hip replacement 2 years ago. She is very fit and healthy. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigation you need to know? The patient is unable to bear weight. What are the treatment options you can offer her? What is the recent evidence about fixation of P2 fracture? That's the treatment received. Case 5. 92 years old recurrent falls. She had AF anticoagulated. She used a frame for mobilization. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigations you will need? Suppose you have a good bone stock and the implant is stable. How to fix this fracture? And what are the general principles? That's the treatment received. Case 6. 85 years old lady. She had a Parkinson and diabetes. Describe what you see. What are the important points in history you need to know? How to examine this patient? What are further investigation you will need? Suppose there is no good distal bone stock and the implant is unstable. What are the treatment options? That is the treatment received. Distal femoral replacement.